Alright, so look at the uterine arteriovenous malformation. Okay, so before I looked at everything, I always love that we break down the words, okay, from the first look. So when you say something is uterine, of course it's related to the uterus. Okay, if you look at this arterial, it's looking like an artery, but you're not having venous, it's looking like a vein. Okay, so arteriovenous is more of like what? The veins and the arteries are now communicating directly. Of course, it's not a normal thing, so it's a malformation. Do you understand? So this is what it looks like. Arteriovenous malformation. Okay, you know, the arteries and the veins are supposed to communicate through the capillaries, arterioles and venules. But if you have the arteries and the veins communicating directly, that's when you have the malformation coming in, you know. So it's a rare but it's a potentially life-threatening condition. It involves abnormal connections between arteries and veins in the uterus. Do you understand? So this connection bypasses the normal capillary system, creating what? High flow vascular channels that can lead to what? Severe vaginal bleeding, especially in women of reproductive age. Okay, so types. We have the congenital one, which is what? Present from birth. Alright, involving multiple feeding arteries and draining veins. Okay, acquired. That one, later on, maybe there was surgery, there was curettage, or maybe because of childbirth, it made some one or two arteries to now be communicating directly with the veins. So let's look at the symptoms or complications. So such women that have arteries and veins communicating directly, alright, their vaginal bleeding is heavy, okay, or irregular. Postpartum hemorrhage. After giving birth, you know, they bleed a lot. When they have miscarriage or abortion, they bleed so much. Pelvic pain or pressure. Sometimes it could be that there's internal bleeding. Okay. High output cardiac failure. Okay, so you are losing so much blood, so your heart is not pumping out sufficient blood. So diagnosis, can you see this thing has a lot of colors? Now this is what is known as what? The color Doppler ultrasound. This one you want to identify the red and the blue. Blue is venous blood, red is artery blood. Okay, MRI or CT angiography, you are trying to visualize what? The blood vessels. It will help you to know the abnormal ones. Then digital subtraction what? Angiography. Okay. So treatment options is what? Expectant management, you know, hormonal therapy, uterine artery embolization. This way you are blocking the abnormal vessels so that what? They don't bleed too much. This will help you to preserve fertilization. There's surgeries like hysterectomy. Okay, you totally just remove the uterus. If you're having what? Severe cases and there's a risk of the woman even dying from that, you can just remove the uterus.